Welcome, folks, to the Squeaky Wheel. With me, as always, is my very good friend and the co-host of the Squeaky Wheel, the president, Lawrence Gervais. Folks, I'm Ross Memphis Pambrun. I'm the president, the CEO. I like long walks on the beach. Once traveled with a Hall of Fame rock band, as you can sort of see here behind me. I enjoy my coffee with my friend Lawrence, and each week that we share our Métis podcast, I always enjoy our conversations. So, Lawrence, let's jump into tell me about yourself.
Well, number one, I want to ask you, who's this number one rock band? Is it REO Speedwagon? No, it was Heart, right?
They were those were all very good bands. Yes. So as you know, I did tour with, went down the coast with Rush, and I've had some unique opportunities to be backstage many, many times as we were on tour. I think it was Clockwork Angels. And the rock and roll lifestyle is very unique.
So you clean the bathrooms for them, or stuff like that.
There was a bit of organization that had to happen as helping my friend, and I was the assistant artist liaison on that, and making sure that everybody's that the guests and everybody of the band was well taken care of, and that everybody was managed, and that the show was set up so that the show could go on at every time. And folks, if you think your day's busy, when you're hanging out on a rock tour, things get busy there as well. So it was a unique opportunity to see part of the United States in a way that was different than just watching the show from the outside. When you get a chance to hit, I think it was 12 cities down that you're rolling through LA and you're rolling through all the big name cities. Yeah. It was fun.
My closest link to Rush would probably be, seeing Bubbles quite frequently walking down Queen Street when I lived in Toronto, and seeing Randy. He frequented the same bar that I used to go to, and then all of a sudden they took off, right? But
and then the fellas, they're actually all great friends when it comes to all that kind of stuff. So there's a lot going on in that side of the world. So let's folks, thank you for listening to the Squeaky Wheel. Thank you for all of you who subscribe, and thank you for the ones who send us the information. Lawrence and I always appreciate the conversation that you extend our way. And again, as we see those numbers on our YouTube go up, there's always a big smile on our face. So just to our usual format, we talk about a little bit about coffee. We're going to jump fairly quickly, Lawrence, I think, into current issues, because there's a lot happening in the world, and definitely happening this week. Our Métis connections, and our conversation today is going to be back with Reagan Bartel, because as we're starting to explore the families sending their kids back to school and this unique pandemic that we're all dealing with, I think we're going to have some definite need for conversation. And I want to give her as much time as we can, and then how to connect with us, what to expect, and usually our little rant. So, Lawrence, I wanted to talk to you just quickly about our coffee today is from the Shoe Schwab coffee company. And that, as you know, is where I just spent a little bit of time, and that'll lead into the reason why for our rant later. But the delightful, absolutely delightful. Thank you for all your positive messages and our conversations while I was gone. But I do enjoy the water down there.
Well, it was pretty hot, wasn't it? You had forest fires to deal with. You had
that's right. So there were a few people who had sent me, they're like, well, Ross, you're there anyways, and you're a fireman. Could you just go put that out? I'm like, folks, I'm going to do the best that I can. And that pretty much did the best I can from a lawn chair and watching it just like everybody else as it went by. Thank you to all of those essential workers, those firefighters, the wildland firefighters, and everybody down south. One more thing too, Lawrence, before I move on, is I want to say thank you and a big shout out to Sarah Labucan, who I wore this last week, and this is my Squeaky Wheel. And Sarah made one for you. I just haven't had a chance because I was away to get you this. But thank you to her for this absolutely wonderful beaded Squeaky Wheel that she's made for us, for each of us. So I look forward. I should try and get you yours shortly, but I'm sure I'll see it sometime next year. Next time, or I'll wear yours. I'll wear two, and that way yours gets seen on as well. So big shout out to Sarah, and thank you for that. The last week we had the Heritage Roasting Company, which a couple wildland firefighters. So maybe that's the interesting tie-in for that. We talked with Amy Willier from Moonstone and Moonstone Creations, and she is bright, exciting, and very engaged within the Métis and First Nation communities. And I think she's very strong at giving back to everybody in those communities.
Yeah, I mean, she's a wonderful artist. Her shop is pretty well known, and Moonstone, people go down there in Inglewood and look at all their artwork, and they have artwork that's posted there, and some of it's for sale, and also they do classes in there, and also the front boutique area. Try on a shirt, put some earrings on. That's what Ross kind of does, but when he goes there,
I just use a clip-on earrings.
Oh yeah,
that way I don't leave a hole. And when we talked to her about reopening business, so
yep.
This week, Lawrence, and because of what's happening, and I know we'll be having Reagan on here shortly, but I wanted to before we jump into her, because there was one thing I wanted to talk about this week, which is the proroguing of Parliament. But then I also wanted to ask you we have mentioned it before, and we've talked about racism and the challenges, but what's the unique challenge that's happening right now with the NBA having had some stop games for the Black Lives Matter movement, and now they might be forfeiting the season. When I see that this is happening, and it even for us, and this seeing to this level that professional players, respected players, these men and women, because I think the WNBA is having this conversation as well, that by making this decision, they are making a very strong statement that this conversation cannot go away. The challenges within a minority group, including our minority group, it's if we don't have these conversations, and maybe this is the level they had to have gone to in order to not necessarily change minds, but increase the conversation that happens, that Black lives matter, all lives matter. But this is a statement that I think, and if they're saying it, and if they are acting, and definitely if they're bringing it forward, we have to give them all the respect. It's just a challenge, a unique challenge.
Yeah, I mean, it's one of those things where people have to listen to it. It's not about all lives or white lives. Their focus is Black Lives Matter, and they're trying to get this message out. And they do it in the most impactful way, and they're going to move in increments where they're going to keep going forward until people start to realize when police or what they're doing as part of their training realize that there needs to be steps here. It's not just one of the, and it's a very hard job to do, but if you don't have the proper training to keep moving along, we get to situations like this. And it's not a knock on, because it's a very taxing job, and that training takes a lot of money, takes a lot of time and effort, but sometimes that time and effort needs to be put in place. And for the Black Lives Matter movement, people try to degrade it or downsize it, and that is a wrong thing to do. And this is a response from it. You have, I would say, political leaders that are in the States that are on very different views of what Black lives means to them. And they're trying to change that systemic racism that's happening down there. So, it's just, the Métis Nation, we put it through context, it's not currently happening to us that we know about, but I'm sure it is. And, Louis Riel and all the impacts of colonizing this Western Canada, well, he took a stand and said no. And then there was repercussions because of that too. And, families were dragged through the mud, literally. And there were people dying because they were Métis, and they said, yes, this is who I am. This is my community. Right. So, those stories are all out there, and nobody knows about them too much. Right. But it gets to a boiling point, and now that boiling point is starting to boil over. We're talking about big business for the NBA. We're talking about big deals in terms of sponsorship, all that stuff. It'll affect everybody across the board, and I hope they really come to an agreement. And I know they're meeting today. Today's Thursday. We're filming this, but I know they're discussing at that board of governor level at the NBA to kind of decide what's going to happen for their season.
And I think in some cases, and definitely within the Métis community, from the time of Louis Riel that you talk about, a lot of times we think that impact will happen by the next day, or we would like it to happen by the next day. I think a lot of this conversation that's happening within these leagues will impact the youth who see that that people are stepping up to at the highest levels to say we need a conversation. And this isn't a question of we want one. We need it. It has to continue. And the conversation, and if it doesn't happen, what impact can we continue to make in order to make sure that voices are heard?
Yeah.
So
and if the league continues and they play games, and he continues sending the message that Black Lives Matter and get their support, get the conversation going. But you're right, to put a stop to the season entirely. Well, do you stop? Like, how do you continue the message to keep going to younger people, right? Because they're the future leaders. They're the ones that you want to change. That should be your prime goal.
And maybe maybe the players feel as though stopping one game isn't enough. Maybe we have to stop at a bigger level. And I don't have the answers, folks. I think that, but we have to respect their conversation, be a part of the conversation, and learn from every one of these conversations. Proroguing Parliament. What happens? I mean, we know that it stops government conversation at that level. Is this a tactic so that the Conservatives haven't chosen
the committee
or have chosen somebody?
Like when they prorogue Parliament, everything is kind of going well. All the committee work, therefore the COVID committee work is done.
Right.
The Indigenous committee work is done. The We committee reports that were sort of coming out are stopping. So and is that the prime goal of government saying, let's put a stop, because of the We committee? Let's put it to the side until we start meeting again in the fall, right? After they've already had a big break already, right? Yeah. So I mean, that's another concern as a Canadian citizen, is that we go, well, how come they don't want to meet? They don't want to talk about this. They don't want to.
Yeah, they don't want to talk about this.
Decipher things through, right?
I know we're in the West, so I know we already kind of have our opinion on how things are going. At the end of the day, I respect anybody who got elected. I respect government officials and I definitely respect you for stepping up to the plate in those roles. I think those are unique. These are unique times. There's one more challenge. I would prefer to have seen more conversation continue to go forward, but I guess we're going to have to wait and see what the Liberals decide to do.
Yeah, I mean, and that's the thing. They have this is the Liberal time right now. It's kind of, they're running the show. Sometimes those votes don't matter too much as soon as they reach Manitoba and westward, right? But it's leaving a bad look, when you put a stop to things and you're not dealing with things, because the Métis Nation, on some levels, we get into that habit too, and we kind of have to go, no, our citizens are asking questions. We have to deal with this, right? Yeah. And that's, for any government, they have to understand that you get to a certain point where you got to deal with it,
Yeah. And maybe this is how they're dealing with it. And folks, whether you like it, dislike it, you have every right to vote when that time comes due. So make sure that you stay informed, continue to watch the Squeaky Wheel, and we'll hopefully have some opinions for you from the side that comes from definitely from the Métis Nation or from our Squeaky Wheel podcast regarding the things that come from the Métis Nation. So, Lawrence, I think it's time that we bring on, because as we've had some, challenging conversations here already this morning, let's lead into the next one that is current as well. That's going to be with our guest, Reagan Bartel, regarding, hopefully she can talk to us a little bit about what's going to happen here with the schools going forward. So let's welcome her to the Squeaky Wheel. Folks, I'd like to welcome to the Squeaky Wheel a very good friend of both Lawrence and ours, the Director of Medical Health with the Métis Nation of Alberta, our province, our representative. I'd like to welcome again it's been since June 5th that we've been riding out this pandemic, since the first time you came on to the Squeaky Wheel podcast, Reagan, and we're excited to welcome you here. Lawrence and I this morning in our podcast, we've been having some challenging conversations that have been happening. And I think that though that conversation will continue for the coming months as the challenges and the recognition, where I wanted to take our conversation is into the challenges that are happening within the medical community still, our community, and what's leading into the families and school community. So it's probably been since June 5th. That makes it just about July, August, a good month, 2.5 months. So before we jump into the heavy hitter questions, tell us a little bit about how things have been going for you for this last 2.5 months.
Well, things are great. I mean, 2.5 months seems actually short. My first briefing note related to COVID in Canada actually came at the beginning of March. So it's been 2.5 months since I've talked to you guys. But the journey has been long. And I think one of the biggest challenges that, Alberta and certainly our Métis community is facing, and certainly me as a technical professional, is just that exhaustion. It's tiring. It's tiring to feel afraid. It's tiring to worry. It's tiring to be looking for employment in a time when employment has all sorts of challenges. I think that especially for us, it's challenging, and I'm feeling it right now. And I don't know how you guys are, but the summer months were those months where I recharged and refreshed and got together with our community. So, not having the opportunity to be Camp Nurse Huckleberry for a week and connect with our Métis youth, and not having the ability to, meet with friends and relatives at our annual General Assembly for obvious reasons. I mean, I think that we've made the correct decision in protecting our communities and not contributing to the spread of COVID. But I think that some of those challenges, they impact the health of our community and all of Alberta. And so I think that has been a struggle. I think one of the other challenges is that amongst pretty much everybody in healthcare and everybody within the MNA in whatever role, whether you're a community member, whether you're a staff, we care. And so that is exhausting. And now we add those extra challenges of, kids are going back to school, and what does that mean? And what does that look like? And that adds an extra level of stress. I personally, I'm not a parent, but I'm an auntie, and I like to think I'm a good one. And so I have been doing my due diligence, not just, on the health side of things, but, as an auntie, trying to figure out, what does this mean going back to school? How can we do this safely? So I think those are kind of some of the current challenges. And then all of the discussions that have come up around mental health, mandatory masks are a big thing in my world right now. And so all of those different layers, have led it to be kind of an interesting time. I guess that's maybe where I'll stop, and then.
No, I'm curious. My wife is a nurse practitioner, and as you know, our familiarity, you and I, from the Royal Alex Hospital up in Edmonton, in the ICU. When I walk around our community, and this is a shout out to all those folks out there who still have that sign that says, "Thank you to our frontline workers. Thank you to our nurses." That means something. It's that one more pat on the back that says, we hope you don't stop what you're doing because of those distinct challenges. And, we've had conversation, you and I, before regarding your ability at the level that you're at, where as you've moved up through the ranks and through the experience and such, that you're in part of the conversation. And I hope it's okay that I mention this, but you're in conversation even with Dina Hinshaw and the unique challenges that she experiences. And we experience those challenges at all levels. So when you walk around and you see one of those signs that says, thank you to our frontline workers, thank you to our nurses and our doctors, and thank you to all those people, where does that warm? Does it warm your heart?
I mean, what it does is give me an overwhelming sense of gratitude. I mean, obviously, because I'm a healthcare professional, I take it to a personal level.
Yeah.
And I think deeply about my family that is still working in the hospital. So, I mean, where I take it to is that place of gratitude. But I also feel that gratitude. I see those posters for healthcare workers, and obviously credit due for sure. But I'm equally overjoyed to see the thank yous to the essential workers who have kept our grocery stores running. And now I think we're going to start to see, and at least I'm hopeful that we'll see that same support for the teachers and even the parents who are, making those, moving into those uncharted waters in the same way that nurses, didn't know what to expect. Healthcare professionals didn't know what to expect. And they had all of these questions and fears and uncertainties. And you know what? They stumbled in the beginning because nobody anticipated it, and they evolved and were flexible and adapted. And now we've come to a place where I think everybody in healthcare is exhausted.
Yeah.
But they've persevered and they've done it, and they've supported Alberta in, this COVID journey. And I think we're going to start to see those same shout outs of support for our teachers. Because I think, they're in the same place, right? They're facing the same, uncertainty and questions that I think healthcare professionals had in the beginning. So when I see those signs, I think, okay, yep, we've got it coming for teachers, and we need to give them their support because they've got a tough and uncertain job coming up. And I just know that they'll persevere too. So I see those signs, and I think, I don't know, they make me happy because so much of the narrative around COVID is fear-based and negative. There's that infodemic that people are suffering from. You can go on Facebook and have 18 opinions in 3 seconds. So I think that, the messaging that's out there, those positive messages, are something that I just hold on to. So,
well, and I like to think that my concern regarding when it comes to things like social media is it's just a snapshot that makes people react. I like to hope that our conversations and definitely Lawrence and I's conversation all the time is, like you said, that is part of the narrative. It's, folks, you get a chance to listen to the conversation, not just hear one or two words that have been tweeted out in order for you to make a judgment on what the conversation was about. So moving into the idea that the schools are opening up, and Lawrence and I were earlier talking about the challenges of government and such like that. Lawrence, with your family, and we talk about, your son and daughter and the kids and the fear that happens when it comes to that. Lead us in, Lawrence, a little bit with how some of the thoughts that happen when it comes to the schools, when it comes to sort of the Métis schools, and what information do we look for from our medical director and our directors of health when it comes to the schools?
Well, first of all, I'd like to, it would be nice actually we had a Métis school. I know that's sort of the scope that the MNA is currently working on with the Alberta government to even get a Métis school that's given. But no, it's a very hot topic, especially, within our house, and I'm sure within a lot of households. My children are only 4 years old, and moving into kindergarten is not a huge impact. What you really have to worry about are the ones who, and me and my wife are able to work at home. What you have to worry about are the ones that can't work at home, that have to be faced with a challenge. Do I send my children over to possible unknown circumstance, right? Whether I support mask wearing, where I don't. When they say near normal circumstances, that always just breathes just normal to a lot of parents. So, you really have to gauge, where the city is that you're in and the attitudes around the citizens that are there. And you really have to decipher whether this will be a safe point or will it not. Is it just a test? Is it just because the numbers in the hospitals are down, so then we go in and it's okay to get, flu, like stuff. So, you really have to understand that, well, we're sending in our children, our little ones, is an atmosphere where they can carry a virus. And in fact, when we started, we had our twins, we started getting sicker during the day, like during our day to day, because they were going to preschool and bringing home stuff, right? So they are little carriers. They may not show that they're getting sick, but there is a very high degree of uncertainty that, you're sending your children, and then what are they bringing back into your home, right? And that's, I think, a big fear for all of us.
Absolutely. I mean, again, as an auntie, I'm thinking of all these things. I don't have, children myself, but I am certainly sympathetic to these tough decisions. And I think one of the things, like from a health perspective related to school, and I think, again, we had kind of talked previously about how Dr. Hinshaw has a really challenging job. And I think when we're looking at back to school, I think it's really important for people to kind of have a moment to reflect on, they're weighing risk as more than just COVID. So for the last, I want to say 6 months, we've had this narrow focus and we've looked at what COVID does, how does COVID impact our lives? But what we haven't factored into those things is, okay, what are we missing because of COVID? So we know that children do require camaraderie and companionship and opportunities to learn from each other and socialize. And we know that if they don't have that, that does have significant consequences, and particularly within our Métis community, because we know from what we've heard from community through our health forums and our other engagement opportunities, that those social connections are actually part of our own health and well-being. And so even, Dr. Hinshaw's assessments aside, looking at from a Métis perspective, we know that not having those social connections has a big impact on our children's mental health. We also know, and this is, I'm not making generalizations, but we do have some information that says that Métis children often will have an educational gap anyway, because we do have challenges with some socioeconomic stuff and other social determinants of health that are not necessarily at an equitable level from the general Alberta population. So now, if we don't have our kids have that opportunity to go back to school, are we digging them a deeper hole? And so when we're looking at, how do we choose whether to go back? Those are all of those things that poor parents have to consider, right? Okay, well, is my child's mental health going to suffer if I keep them at home for another year? Are they educationally going to be okay if I keep them home? And so I really, there is no wrong answer. That is what I'd like to convey to our community. Whatever choice that you make, it needs to be based on what you as a family are okay with. So, that's going to be looking at things like, okay, well, where is my child? Can they learn from home? If they're not somebody that can, maybe you're going to be considering school for that reason, because you're willing to take that risk. The medical public health professionals have taken a look at all the evidence, and I'm not going to kind of rattle through that. It is available online at alberta.ca/COVID, and you can find all the information that they're basing that decision on. I'm not going to lie, there's probably political implications. I'm not blind. I know that it costs a lot to implement all these public health measures. And so part of the reason why we're sending people back to school is to boost the economy. That has to be factored into the equation. I don't want to give anybody the impression that I'm completely ignorant of that fact. But what I do think is that parents need to consider what they feel best. And as a community, we need to be okay with that. We need to stop with the shaming of parents who are choosing to send their kids back to school, because guess what? That might not be a choice. We say it's a choice, but a lot of our community members have to work. It's a choice between sending my kid back to school, potentially risking COVID, it's not guaranteed, or feeding that child.
Yeah.
Well, that's not a choice. You're going to feed your child. You're going to send your kid to school so that you can feed your child because you need to work. And so we need to be kind as community members, as Albertans, and as human beings. You know what? My sister is sending her child back to school, and I'm okay with that. And you know what? It's not on anybody to tell her that that's a bad choice, because the choice that she is making is the one that is right for her family. And I think we've learned a lot about flexibility. And I think school zones and school districts are really trying to give parents a little bit of options within the school. That's another thing, you know, if you need information about what's going on within your particular school, the best thing to do is actually get in touch with the school, because while the information on the COVID webpage will have kind of broader guidelines and general guidelines, each school will have their own plan on how they're going to mitigate risk, what that looks like. And so I think that, you know, parents who are making that choice, you know, to be as informed as you can, and just know that the broader Métis community is going to support you in whatever, because it's a choice that's for you. Obviously, if you're choosing to send your child back to school, there are things you can do to, you know, keep kids safer and keep your family and your cohort around you safer. So things like, you know what, how do we make masks fun? Right? Mm-hmm. Maybe the child gets to watch a special TV show while you're getting them used to the idea of a mask, and they only get to watch that TV show when they're wearing a mask. You know, modeling that behavior. Hey, mom and dad are wearing a mask. See, they're not so bad. Finding masks that have like fun patterns that kids are engaged with. Teaching them about, you know, not touching your face. I know that I've heard of community members that are playing fun games where, you know, if you don't touch your face, you know, we'll go for a walk to that park that you really wanted to visit, right? So there's ways to control that, and also recognizing that you're not locked into a decision. So I think that's one of the things that most school zones are considering, is that, okay, well, I've decided that I want to try this out. I'm sending my child to school off the hop. You know what? I'm not okay with it. So the next semester, or right now, we'll transition to home learning, and being okay with that, and being gentle with yourselves as parents, because you know what? Think about how this pandemic has unfolded.
Yeah.
Minute by minute, that information has changed. And so you're going to be frustrated if you're looking for a clear answer.
Yeah.
Be open to the idea that, okay, this is the answer I have right now, the best information I have right now. So this is the decision I'm making. And allowing yourself the option to change your mind and be okay with that, because we don't know. We absolutely don't know. I mean, we have some promising data that says, yeah, kids are probably less likely to, you know, get COVID. They're probably less likely to have severe symptoms. You know, children under the age, I believe the current evidence is, I think it's under the age of 12, are less likely to spread it. That doesn't mean they're not going to spread it, but less likely. So, you know, given all that information, the choice that you make is a good one.
I think, I guess one of the questions too that people are sort of having is and I respect absolutely every point that you made there regarding folks. If you want to get a little bit more information about what the Métis Nation is doing, make sure you go to Métis.org or go to Métis3.org, and we'll steer you in the right direction for some of the information, some of the tools, some of the products that are available out there for your Métis family, for your Métis students. But that, yes, these are the hardest decisions that these generations, this family age generation now, you can't look to your parents, you can't look to your grandparents on what answers. So these are unique, but I think respectfully, with the numbers that we've seen, when it comes to the challenges to our healthcare, when we do have exposures, and I think, yes, we are going to see, but I'm curious amongst the three of us, in the case of now moving forward of the decision, your respectful decision, if people want to go send their kids to school, if we look at this as in a sense, a litmus test of we're going to try this in September, I ask everybody who's listening, as well as you three, did you ever, when your mom said, don't touch that, that's hot, did you ever touch it? Well, I touched it and it burnt my finger. And I realized that that was hot. Lawrence, you?
No. I had a rational thought when I was a child. No, I'm just kidding. I probably went near it, but I probably wouldn't touch it.
Oh, okay. Whereas me, I put my finger on it. Of course, it burned my finger. But, okay. See, and Lawrence, I'm quite confident if I talk to your mom, she's going to say no. At the end of the day, Lawrence, they touched it. But I think as because this is such a new experience, just like burning your finger was a new experience, I think we're doing this with the most respect for the families, most respect for the school system, I hope. And I hope the teachers feel as though we're trying to give them that respect, but we have to try. And the information that we get from that will determine how well we're trying and the decisions that people can make. Now, how do we monitor that situation?
So I think there's a number of ways, and I just going to caveat this with, I am not an epidemiologist. So the knowledge that I have, I'm happy to share with you. So the public health professionals have guidelines in place, and they will be monitoring through the school district. So they'll have training with teachers. So if there's any child that has a symptom or comes down with a symptom, public health will swoop in and support that school. And so they will be monitoring essentially through the staff that are there. And I do have friends within my circle who are teachers who are going to be hyper vigilant about these things.
Yeah.
The other way that we're monitoring, believe it or not, is parents. There's going to be a large role. Parents will have to self-screen their children on a daily basis before they send that child to school. And so that doesn't seem like it, well, it doesn't seem like rocket science, truth be told, but it is, you cannot underestimate the power that the parents have to make this go well. Yeah. So, having that control, having that ability to look at your child and be like, this isn't normal. I'm keeping them home. I'm also informing the school board so that we can keep everybody else safe, is an incredible tool that we have to monitor the situation. I think on the broader, I can't speak to how Dr. Hinshaw will use that information, but some of the other things that they're doing is they've requested that teachers and support staff for the school, I believe there's about 90,000 of them within our province, go and have a COVID test, make an appointment through AHS, or you can go to your pharmacy because you're asymptomatic, and have a test prior to school starting so that we have a baseline understanding of where our teachers are at before we start, so that we can assess the impact once we start school. So if we had 90,000 and 90,000 were free of COVID, but a month in, suddenly X number of teachers have had positive COVID tests, perhaps we need to revisit our public health measures, or other things. And so those are kind of the ways that I can see that are just kind of general monitoring. And I definitely don't, I can't speak to, well, if we have an increase of 1%, then I don't have that level of detail available to me right now, but I know that they will have a plan. Obviously, they'll still be watching hospital utilization to see the impact that school, because we know children don't live in silos, right? Yeah. Children have access to other children, and then from there it spreads out, other parents, grandparents, extended families. So they'll be watching the same indicators in terms of hospital utilization, severe outcomes, ICU admissions, that they always were. And right now we're in a good position. I mean, yes, we have case numbers, and yes, we're going to see them in the schools. But I think the fact that parents and teachers, people that truly care and are right there all the time are monitoring that, I think that will provide some assistance to that situation.
I guess in this situation, folks, make sure you get out there with your family during this nice warm weather and realize that the numbers will start to tell us how we move going forward. And again, this is all very unique to us, and everybody I usually end up talking to is like, well, they just want things to go back to normal. Well, the old normal might have been too much of a luxury that we didn't realize we should have been enjoying at the time. And again, I think we're going to see ourselves through this, folks. We've been through pandemics before. It just hasn't been our generations. It's been challenged to the generations before. And maybe there was other times that things were impacting the world that they didn't even realize pandemics were going on, because back in the 40s, they were dealing with World War II. And back in the early 1900s, they're dealing with World War I. We don't know exactly. There were things that were happening. And then when the Spanish flu and the other pandemics that were happening, this is, we're going to have to wait on some of that information as we move forward. But at least we're still having this dialogue now in order to help reduce some of the fears. A question I had, and Lawrence and I were banging this around a little earlier, was when it comes to your role, and this is just more out of curiosity, it's not really an impact specific to Alberta, but federally, what relationship happens provincially that that garners information regarding Métis health? Or does it just happen at a provincial level? And Lawrence has a very strong role when it comes to all of a sudden representing political or the provincial things. And then the next thing you know, he's being invited to Ottawa. And half the time I'm like, well, I guess I'll see you when you come back. Sometimes I forget where each individual's roles go. But when it comes to this, and we're talking today about healthcare, where does that come from?
So my role is amazing. I first of all, I want to caveat that. My role is to take the voice of Métis Albertans to all levels of government at any opportunity I have to talk about the health priorities that are coming out of community. So there's multiple ways that I determine those priorities. One of the biggest focuses that I have is ensuring that the perspectives and experiences that folks share with us at our community engagements is brought into like a tight theme, and then that's how I prevent it. So there's a number of different ways that I do that. Often we'll have specific priority meetings. So for example, mental health is a big priority for our community. It was prior to COVID, it's become even bigger now. And so, I take that to federal tables and say, well, community members have indicated, struggles with access, struggles with cost, all of those different things that come out. I also take my direction from leadership. So folks like Lawrence will call me or email me and say, hey, this is what's going on in our community. The next time you have an opportunity at a technical meeting to bring this up, please do. And so, not only am I getting it from community members directly, I'm getting it from specific regional representatives and locals who are saying, okay, you might have a giant picture, but within our region specifically, this is happening, and can you say something about it? And I'm so honored and privileged to be able to do that. For COVID specifically, all level of governments have had specific meetings that I've attended. So I've looked at things like lobbying for more equity related to internet. It's become an essential service. So what you might think as a normal health role, oh yes, we need subsidized health benefits, which by the way, I'm always pushing for. But it's the little things like education has an impact on health. If we can't have equitable internet, particularly for folks who don't have, stable economic backgrounds or who are residing in the north where the infrastructure doesn't exist. So I lobby for things that you might not think are related to health, but improve the overall health and well-being of our community. Does that answer your question?
I absolutely. I think that it's not an easy answer because, again, I know that your role in the direction that we in our provincial representation takes us at a federal level, we're looking all the way across the spectrum of the Métis community. Here we were talking about health and the idea that our provinces are still somewhat directed by the province itself. And I know when we get more information that comes out of this, eventually we'll continue to share those conversations with the rest of the provinces and the other provinces to see how their numbers are reacting and what's happening with their Indigenous communities to see what's happening. So I was just curious as to, does information come down that way? Well, I don't want to get too far into
Ross, I just
that
want
conversation.
to, comment that, I think, as a Métis community, we know where the problems are. We know absolutely holistically what, the well-being of an individual, but we always try to sell that as much as we can. And we look like salesmen to governments to support it, to other people to support it, to other people to do that. We're only at a very small percentage of where we are supposed to be holistically and helping our people, but we want to do it full circle, right? We want absolutely everything that we have in place for them. As soon as there's a problem that arises, we have an answer, and that's what we want this Métis community to do for our people, right? So, we do have we have carry lots of expertise, but it's just a matter of getting government to support it. And Reagan's role is fairly new, but she's accomplished a lot. And these agreements with Canada are accomplishing, a lot more. And to every degree, we just move on to the next thing, to the next thing, to the next thing, until we can go full circle.
Well, Lawrence, I was actually going to throw it out to you that you get the opportunity to close out the conversation with Reagan, and yet you just did that absolutely wonderfully. I think, folks, the one thing I also want all listeners to remember out there is that Reagan's always available. If you go to Métis, Métis.org, you're going to find her information. But I think more importantly, that folks in your communities, make sure you reach out to your locals, which will send the information to the region, which will bring the information to the awareness of Lawrence, who will send that information to Reagan, who will get that to the other regions, who will get it down to the locals, who get it down to the citizens. So we need to all work together to help make sure that information gets shared at the top. And with Reagan here, and I read your information that you send out, that is your sort of almost weekly newsletter that tells us what's happening with you're capturing the number. Lawrence, you do the same thing of sharing a lot of that information with the staff, with the citizens, and sharing that. So thank you for that. I guess I mentioned before that we were going to see you on our show. And as this continues to move forward, you might be on sooner than 2.5 months, so you can tell us what's happening with some of the numbers.
It truly is my pleasure. Like I'm here for community. And so, to have an opportunity to even just say, you know what, you guys, you're going to get through it. We are resilient people.
We are.
Life is weird and kind of standing on its head right now, but you know what? It's standing on its head for everybody. And you know what? Our community lifts each other up. I mean, yesterday in Calgary, at the head office in Calgary there, we had a mask distribution and we distributed more than 3,000 masks.
Yeah.
So, I mean, we did that together, right?
Yes.
And so I'm just grateful for an opportunity to be a part of that togetherness in our community, and always happy to have a conversation with you guys.
Well, here on the Squeaky Wheel, I like to think that we've developed a very good provincial relationship with our guests and Audrey and all of our other guests who have come on. And I think, Lawrence and I always look to try and make sure we further our conversation, but we want to make sure that we really identify within the region that this is, where our strength comes from. We want to expand that strength to be provincial and then share this community message for all Métis people. And you're right. Though we're representing a certain population right now, we're all Albertans, we're all Canadians, and then we're all citizens of this wonderful blue spinning water globe that we're on. So thank you very kindly from the hosts here at the Squeaky Wheel. And Reagan, I appreciate your time. We always look forward to talking to you.
Anytime, guys.
Thanks a lot. Best wishes.
Bye-bye.
So Lawrence,
she
always speaks so eloquently.
Yeah.
Again, I always make comments that you speak so eloquently.
Well, I try, but
she's easier to look at because I got to look at you just about every day. And she is so delightful. She always comes with such a positive attitude. And these are challenging questions that everybody is asking. And I know you get asked these questions all the time. What's happening within our region when it comes to the distinct this challenge of going back to school right now.
Yeah.
What do we want to add at our region level in this conversation?
Well, I just believe that, even as Southern Albertans, if we look at that we're cognizant that people have differing views on this whole thing, and we need to still work as a community. Whether your judgment of other people and that's how you walk the earth, well, then that's your thing, right? No one's going to judge you back, but you're consistently judging other people, right?
Right.
But we need to reverse that a little bit. And, the judgment just needs to go away. And we just need to walk the earth, just like any Southern Albertan. If somebody's wearing a mask, okay. If somebody's not wearing a mask, okay, Yeah. But we really have to understand that, there's a reason why people are wearing them. It's because they have a safety thing in their mind, not only protecting themselves as a family, but protecting other people. Right.
Yeah. And that's the approach that I've taken.
That's right. And then there's, the non-maskers who certainly don't believe that the government should be telling them what to do. Well, in our Métis community, we've always thought that, and Otipimissawak is based on that principle and that teaching of not depending on the government, and we should just govern ourselves, right? We don't need them.
Yeah.
Why would we need anybody else to tell me what to do, right?
Yeah.
But I think this is a little bit different because it is a virus. It's a real thing. It's not something that's made up, and it's how do we react as a community? That's the most important.
I think we see a lot of those people who are anti-maskers. I wonder if 30 years ago, there's no way they're wearing a seatbelt.
Yeah.
There's no way I'm letting the government tell me that I got to wear a seatbelt. Well, how many years of proven science do you have to see? Is it 10 years that shows that the people who were wearing seatbelts when they got into accidents ended up faring better? Is it 20 years? Unless somebody says to me, here's the distinct harm wearing a mask is causing, I would prefer that they wear a mask at this time when the government says, hey, here's maybe something we could do to protect everybody. I prefer it. I respect it.
Yeah.
But
you see, it went in waves, right? So, police enforced the seatbelt laws, and then people kind of changed. But then they didn't really change until the media started showing these accidents, and then it was, teenagers dying every graduation year. And, people started to understand, maybe I should put it on, right?
Yeah. Bless Mothers Against Drug Drivers and the groups out there that are sending out that the challenges that they've faced in their families as a result of, poor decisions and
And right now, the police are only enforcing crowd control, right? They're not enforcing masks. They're not enforcing, this is a personal choice, right?
Yeah. And how we get to that, right? This seemingly snuck up on us pretty quick, the pandemic. How do we get around enforcing that? Who should be enforcing it? And
that's right. And, crowd control, I can kind of see. This is a virus that spreads over crowds, but they're not going to sit in front of a superstore and watch people going in and out and, arresting or finding people who aren't wearing masks, right? That would be a totally situation that I wouldn't agree with, right? But
do we start deputizing everybody at the coffee shops and at the grocery stores? Hey, if somebody comes in here, you now have, you've been deputized. Here, hand this guy this ticket.
Yeah, and I'm sure the police don't want to do that. I mean, they have other things they have to deal with rather than monitor people who are wearing masks, right? It's just a conscious decision as a citizen, whether you choose or you don't. But don't base judgment on either or. That's wrong.
Yeah. So folks, when you're asking your questions, thank you to the people who have been sending me emails regarding some of the previous guests that we've had on. We've opened up conversation and dialogue with people who had watched Sergeant Major George Pambrun, my father, who had come on to talk. And in his conversation, and you had mentioned, right, the funds that were becoming available for Métis veterans, a lot of families have started seeing that. And they've also started asking questions about, their family members had served or continuing to serve. And where's, what's available for conversation, what's available for awareness. Our Squeaky Wheel's doing its job, folks. And the questions that we get asked when it comes to consultation and things that come into our email, make sure you continue to send all that information to us. We appreciate it always and appreciate the people who are listening. One of the things that I wanted to rant about, Lawrence, today was the drivers and provincial respect. So I think I hear too often that somebody in Alberta saw a BC driver, and on the opposite side of it, somebody had gone over to BC, that BC's asking for our tourism dollars. I know Alberta's still asking for the tourism dollars that can come our other way. But too often I'm hearing the stories. And there was in a recent news report, I think it was in Vernon, one of the counselors had saw a guy in it, walked over to his truck and peeled off a BC license plate from the front and off of the back that then exposed his Alberta license plate. So he had put these things on so that his vehicle didn't get vandalized.
Okay.
And having been in BC just last week, I had somebody yell at me because my truck had an Alberta license plate at me to pretty much go back to Alberta.
Oh, that was probably me though.
That was probably
because you have this big blue truck or, whatever you're driving at the time. Yeah.
Yeah, that might've been you who was yelling at me, but there's not much of a divide between Alberta and BC folks. So I think there's a spot for everybody. But again, if people are doing their due diligence of being respectful within communities, being respectful within other people's communities, wearing masks where the community asks for it, or providing the social and physical distancing, I think there's a way for us all to get along. So hopefully I don't get too many scathing hate emails from BCians.
Well, you're back in Calgary now, so I wouldn't worry about it.
Yeah, so I'm perfectly fine. Because nothing bad ever happens here, and the sun's always shining, and it's always good for us. So,
yeah, I mean, I kid too much, but I mean, I have a lot of friends and relatives in BC. I mean, I'm originally from there, right? But
absolutely,
it is true. I mean, people get unnerved, and I lived in the Okanagan when tourist season comes, and they call it terrorist season because it's just Alberta people coming into their communities, and then they leave, and then everybody's fine again, in September, right? So, it's just one of those places that we're only 4 or 5 hours away of a drive, and you're in a nice, beautiful area, and it's no mark on BC because they have a wonderful province, right? But it is true. There are some Albertans that do take advantage of the situation, and I've seen it, personally. And living in Penticton and places like that where I'm a BC resident and I see these young Albertans walking down the street with full beers, and it's the middle of the day and we're all just going to work and picking up our kids from school or whatever, So yeah, it's just, it gets a little bit too much, and that's on a regular season. Now you add COVID and it becomes something else. Yeah.
Actually, you're right. I got to give you that. That's actually a very good point. Here, I'm only making a rant about some license plates, but there are other things that are going on out there. So, folks, please continue to do things respectfully. So, Lawrence, I'm going to close this out there if that's okay with you. I definitely want to say a big shout out to Reagan Bartel and for her time and for her conversation that she continues to have with our medical director of health for the province, Dina Hinshaw. And again, we always thank our frontline workers and thank our essential workers and thank for those people who are doing their due diligence. I want to shout out to our elders and our seniors. Thank you to the treaty lands and the Métis settlement lands and our Métis lands. Thank you to Mother Earth for sharing this time, sharing this space with us. And I want to thank my co-host, my friend, the president, Lawrence Gervais. And from the Squeaky Wheel, subscribe to us on our YouTube channel. And we look forward to hearing from you and talking some more.